Morning, everyone. Sorry I can't be there this morning. I've got sick little ones. I'm going to be telling you about emergency contraception, or otherwise known as the morning after pill. They may be used after unprotected sex or after contraceptive failure, such as a condom breaking or situations of rape, and etc. And they're commonly, the most popular ones are Plan B, One Step, and Next Choice. They contain progestin, levonorgestrel. Um, they inhibit ovulation and interfere with the corpus luteum function. Um, they are effective if ovulation has not already occurred, and you can get these at the pharmacy with a picture ID, because as long as you're over 18 years old or over 17 years old, you do not need a prescription. But they do keep them behind the counter, so you do need to speak to the pharmacist in order to get it and show them your ID. Ella is another one, and it contains ulipristal acetate. It acts to delay or block the luteinizing surge and ovulation. Basically, it temporarily blocks egg production, stops fertilization, or inhibits implantation. Emergency contraception usually involves taking 1 to 2 tablets. They're about 85% reduced risk of pregnancy, and most effective if used within 72 hours of intercourse. Ella can be used up to 5 days after or 120 hours. An IUD may also be used 5 to 7, if it's inserted 5 to 7 days after intercourse, and that is 99% effective. Advantages include availability and the rate of effectiveness. Disadvantages, I feel, are potential to overuse of this method. Certain women may not use a regular method of birth control or use condoms, and may use this more often than they should. Another disadvantage is side effects, and there's possible nausea, vomiting, headache, fatigue, dizziness, lower abdominal pain, vaginal bleeding, and breast tenderness. So it can be a pretty uncomfortable experience. You do not want to use if you think you possibly may be pregnant or there's already an existing pregnancy. Another disadvantage is there's no STD protection. Sorry. Nursing considerations. You may want to educate your patients about other safer methods, ones that do have STD protection, or at least tell them about combining methods in order to include STD protection and pregnancy risk reduction. Again, they need to have a prescription, you can educate them and figure out if they possibly lead a lifestyle where they may need a prescription to use later, and speak to your provider about that. Some providers will write prescriptions for future use. Educate them on how to use more consistent methods and ones that are available, and try to find a method that fits their lifestyle. And you want to consider what they do on a daily basis and what method they would be most likely to use regularly, and also one that fits their beliefs. And that's it. Have a good class. Again, sorry I can't be there. All right. I'll see you guys on tomorrow or Wednesday.